Healthcare is one of today's most dynamic and growing fields. Check out the latest in this vital industry.
It's ironic. The same place where the ill go to get better is, in some cases, making them sicker. According to the U.S. Centers for Disease Control and Prevention, about 2 million hospital-related infections occur in U.S. hospitals each year, resulting in approximately 99,000 deaths from these infections and an estimated $20 billion in healthcare costs. Environmental surface contamination is a major cause of this epidemic. About half of hospital-acquired infections are attributed to cross-contamination from hands of patients, healthcare workers, and visitors onto environmental surfaces. Highly resistant superbugs like MRSA and VRE can survive on surfaces for months. It's critical that hospitals' environmental services staff eliminate surface contamination.
We determined using traditional culture methods in combination with ATP bioluminescence technology that the terminal cleaning process was inadequate in reducing bacterial surface contamination on selective operating room surfaces. We found that 100% of OR surfaces were culture positive with heavy bacterial contamination.
Hospitals and other medical facilities are adopting new disinfectant technologies to reduce the human error in cleaning and eliminate the chemical resistance of superbugs. Microbe Care is revolutionizing healthcare as a patented, EPA and FDA-registered antimicrobial developed to combat hospital-acquired infections. Created by Parasol Medical, a developer in medical devices, Microbe Care reduces the risk of cross-communication among a wide array of dangerous microorganisms. These include yeast, mold, mildew, bacteria, and viruses.
Microbe Care is different than traditional disinfectants because it's a treatment. Disinfectants only work when they're wet. The minute they dry, there's a rebound effect that occurs on any surface. Microbe Care is persistent and prevents that rebound effect. We will continue to kill microorganisms, self-sanitizing that surface for years.
Traditional antimicrobials work by poisoning the cell and altering its DNA, taking up to a full day to kill. Microbe Care, on the other hand, works in a matter of minutes. Once Microbe Care is bonded to a surface, it continues to provide protection through 3 functional elements.
The first element in the mode of action of Microbe Care is a silane base that covalently bonds to the surface and cross-links with the adjacent molecules, forming a matrix coating the entire treated area. The second element is a positively charged nitrogen atom that attracts the microbes to the surface. The third element is an 18-link carbon chain that forms an impenetrable matrix of swords. As microbes are magnetically drawn to the surface, the carbon chain pierces the microbe while the nitrogen atom electrocutes it, quickly killing microbes without dissipation.
Microbe Care has been independently studied by doctors and scientists and shown to be effective at maintaining low bioloads on applied surfaces. These results have been published in the American Journal of Infection Control.
We found that a single application of Microbe Care, there was a significant and persistent long-term reduction in OR surface contamination. As we continue to make improvements in operating room design and size to accommodate advances in diagnostic and surgical technologies, effective terminal cleaning will become more problematic.
Healthcare facilities can apply Microbe Care throughout the entire facility. The solution has been successfully deployed to high-traffic areas, from keyboards to monitors to countertops. Microbe Care can be integrated into materials like silicone, foam, or construction materials. Parasol Medical also licenses Microbe Care to organizations such as schools, offices, and public transportation.
Well, by partnering with Microbe Care, Herman Miller has been able to continue its legacy of problem-solving innovation. Our customers love the fact that it's affordable, invisible, and actively works to keep their products germ-free.
Within the next 5 years, experts predict antimicrobials will be integrated into almost every consumer, industrial, and healthcare-related product on a global basis.
Without a concerted global effort to combat the spread of dangerous microorganisms, the growing cost of treating these infections will break the financial back of the healthcare system. But with Microbe Care, we can reduce the levels of microorganisms and the potential of infecting patients, thus reducing the financial burden so many hospitals face.